Coming out of the pandemic, Health West has seen more and more people in a behavioral health crisis.
The amount of people that are in need and need behavioral health services has increased dramatically.
Along with that, Muskegon County has seen significant wait times for ambulance responses. Those in need arriving at hospitals also saw excessive waits. That's all according to a resolution signed by police, mental health groups, and dispatch agencies across the county that put in motion a plan to change the system.
In EMS, we really try to make sure that we're getting the right resource to the right patient at the right time, and it really fell into that mantra quite well. It was a no-brainer from our perspective.
Starting just weeks ago in Muskegon County, when a call is made about someone in a behavioral health crisis, a traditional ambulance won't necessarily respond. Instead, a two-person mobile crisis response team from Health West will, alongside police officers.
It's another tool for us to send a better resource to a person that's in need.
They are trained clinicians taking calls from patients on Health West's Help Warm line. They're around 24 hours, 7 days a week, with generally 2 to 3 teams at a time. Some 911 calls will be directed to this team too.
All right, where are we going?
From there, they'll get off the phone and go out to the scene, aiming to de-escalate the situation.
Oftentimes the team is just trying to provide a listening ear to them.
After understanding the patient's needs, they develop a safety plan to connect them with short and long-term care.
Whether or not they need to get connected to a resource, do they need a therapist?
The team is always on scene with law enforcement, and they don't approach the person in crisis until police make sure it's safe to do so.
Just make sure that the individual is not armed by any means, that they don't have any access to any weapons whatsoever, that they're not combative.
While ambulances will remain available if they're needed, generally they will be freed up to respond to other emergencies. The hope is that will speed up 911 response times.
Kind of helps the entire system, so we're trying to look at it from a macro view. It will help free up an ambulance that may be needed to go to a more urgent call.
As Muskegon County continues to see more people needing help, the group says this approach could be even more essential going forward.
More people are going to want access to this because they realize that the help is coming right to them instead of them having to go somewhere to find it.
Okay, so I want to make. What is the substance that you're looking for detox from?